So everyone, I'd like to introduce Melinda Kintz for those who don't know her. Melinda is a leader in the Batavia United Way and is going to speak to us about the 211 system, some interesting information about how it's funded, who the audience is, what kind of penetration they've already had into the market, and what kind of information is available. So, Melinda, without further ado, welcome. And
well, thank you. Thank you for having me. I was trying to see if I am not a pro at this, I can tell you, because I do have a PowerPoint for you, but I was wanting to see a show of hands, and now I can't get you all back on how many people, maybe Bill, you can tell me, how many people know what 211 is and have heard of it? Sir.
Yeah, I think quite a few actually, Melinda. That was part of us having you today was interest in more details.
Good. Okay, good. So I don't want to give you too much detail or not enough, so that helps. So let me see if I can. How do I minimize you guys again? Shoot. Oh, here it is. Okay. So so you can see my first slide here that says what is 211.
Melinda, if you click slideshow on your menu and then click start from the beginning or start from the current slide, that'll show us just the slides.
There we go.
There you go.
Okay, great. So so what is 211? 211 is, as you can see, an easy to remember telephone number that is live 24 hours a day, 7 days a week. And it is set up to be basically a resource and human services hotline. It is, you can get help in over 150 languages, so that that is great for our many, many languages we have in our county. And the whole purpose behind it is to try to eliminate the, the randomly calling phone numbers to find out if this is the right place I need to go for this particular service, or if we're doing an internet search, which puts you kind of out into, too much information. And as many of you said, a lot of our seniors don't have internet access or computers, so that kind of leaves them out of this, having this resource otherwise. So it's designed to really help everyone, all ages, and again, 24 hours a day. For older Americans and persons with disabilities, they can call, the member can call, or the senior can call, their families can call, get information on where do I find adult daycare, how do I get Meals on Wheels, I need daytime help with my mom while I work, that type of thing. So it's great for seniors. For kids and families, we've got after school care. We have, of course, the basics, food, shelter, rent assistance, summer camps, which is going to be interesting this year. But information on all these things is available as well. Then the other thing is we're just now tapping into, thanks to COVID, is that it really is a backup in the case of disasters, and be it tornadoes, flooding, fires. There's a gas leak in Boston where houses were exploding in a neighborhood. We have the ability to set up information with 211 that people can call in and ask their questions, and everyone is getting the same concise, accurate information. And in the case of COVID, it is our call volume, 50% of our calls last month were COVID related. So it's already proven itself in Kane County. So is it new? No, it's not. 211 has been around since 1997. It started in Atlanta, Georgia, was launched by the United Way there. And it is endorsed by FEMA and American Red Cross for times of disaster. It's all AIRS certified. That's an information referral system certification. So Georgia started 211, and state by state, it is progressively kind of taken over the country. And it is 94% of the country has 211 right now. So Illinois and Arkansas were the last states to get 211. And part of the problem is that is funding. And some states are funded by their government. Some are just random supporters and independent donors. So that's kind of been a stumbling block to getting it in Illinois. So Kane County 211 was spearheaded by my office in February of 2018. Let's see if I have the year right. It was the year of the unfortunate Parkland, Florida school shootings. When that was playing out on television, our city manager, Laura Newman, called a meeting and asked everyone to kind of get together, some different people in Batavia, to talk about, are we doing everything that we can possibly do to make sure people have the services that they need, that there's someone to call in their darkest hours? Are they aware that these services are available? What can we do to make sure that we're staying safe? Because our school district, our police department, a lot of various entities received calls for comfort calls and panic calls, anxiety calls. So Laura wanted to just see if we're doing everything we can do. So at that time, I had been in one of my files, had found the file on 211. It was something that Kane County looked at about 10 years ago. And at that time, it would be a matter of finding a call center or building one ourselves, hiring and training the staff, finding the funding for it. And it was just really too much at that time for everyone, the United Ways, to take on. So so they took a pass on it, and the file just remained there for several years. So I asked Laura if we wanted to dig into this. She said yes. And being a little naive at first, I admit, I found a call center and I said, Batavia would like 211. And they kind of laughed at me and said, well, that's nice, but you need to get the whole county on board. You can't do it for just one city. And of course, now, knowing what I know now, of course, that makes complete sense. So we partnered with our two sister United Ways, which would be Fox Valley, and it was Elgin at the time, which is now Chicago Metro. And we looked at bringing this to Kane County. So we contracted with Path Crisis, which is in Bloomington, Illinois. They are administering 211 for 44 other counties, or 44 total counties in Illinois right now. They were a great fit for us, easy to work with, and just exemplary service. So we contracted with them for the service. And then we went out to find funding. So Dunham, actually we found the funding first, but we went to the Dunham Fund, who gave us a 3-year grant for marketing the project once it was finalized. And also the Community Foundation gave us a $20,000 grant for print marketing materials. So we have a variety of banners and business cards and various marketing pieces that we have available to anyone that needs them. And then our main funders, main supporters are the Kane County government and the Kane County Regional Office of Education. They actually do the funding of the actual service. So service is $60,000 a year, and that is split between those two organizations, with additional funding from the United Ways, and we still have Dunham Fund for 2 years, the grants that will take care of the marketing and the other things that we need to make sure that it's available, and we have all the supplies that we need. So it was quite a group effort for sure. So in talking with the county and trying to identify if this was a great need for us or a benefit for us, they do feel, the county, the police departments, fire departments really felt that they receive a lot of phone calls that are not 911 worthy, so to speak. They are non-emergency calls, and they kind of take up the time of their staff, and especially when there's a crisis going on, they need to be able to focus on the matter at hand. So they are absolutely thrilled to have 211 as a backup to them, and they can redirect calls from 911 to 211, and then they can focus on what they need to focus on. So it has been, people call for, about garbage pickup. They call about, when does school start, things like that. That's all can be pushed over to 211 now. The other important thing is that we do get data on a quarterly basis from 211, and part of that data package is identifying unmet needs. So this is very, very important to us to find out what are people asking for that they're not getting, and how can we address that. So it really helps. We share this information with whoever requests it, and then we are able to do some planning for the future to just improve wherever we can. So in one of our first steering committee meetings, we were going through the unmet needs report, and somebody said, well, one of the unmet needs was an inability to get a handicap ramp for a house for a senior. In 2 seconds, one of the people on the committee said, oh, I know where you can get that. And we called the agency. We have them listed with 211 now, and now that shouldn't be an issue going forward. So it's really a great tool for us for future planning and for finding out where we have gaps in services for our community. And again, the screen kind of shows you along the top, you can see I can't pay my rent. You can follow the red lines to see how many different calls you could be making to try to find help with rent. And you either, you're on hold, or we only serve Aurora and not Carpentersville, or yeah, I'm not really sure about that. Have you tried this? Have you tried that? I mean, it kind of eliminates all that, because the 211 specialists who answer the phone have a database of up to, I think it's over 1,000 resources right now. So they can just work through and keep plugging in different search topics for the person to help them find exactly what they're looking for. The nice thing too is with those personal phone calls, a person can be calling about one thing, and in having a conversation, they can find out, oh, there's help for that as well. So sometimes, as a wise teenager told me one time, I don't know what I don't know. So this is great to have somebody just kind of walking them through a given situation and helping them, letting them know what resources are available. So this is a result of 211, just kind of streamlining things as we talked about, and getting you right. There's so much frustration and just searching and not being able to find the right answer, or someone not understanding what you're trying to ask for, especially if you have a language barrier. I mean, the 211 really has the ability to just streamline everything. So again, basic needs, the food pantry, shelters, rent assistance, utility assistance, mortgage. Actually, these are the top, always in the top 10 reasons why people call. In our analytics, we're able to see who calls, who the caller is, what they're calling about, where they're calling from, and these are basic needs. It's always right up there. And in addition to that, you've got people are so overwhelmed by Medicaid, Medicare, support groups, counseling. There's a support group for everything, it seems, and I have yet to find one that, where 211 sends us away and says we don't have one for that. It's really a great database. Also in the area of employment, this is a hot one right now. Boy, they have just been pounded with calls for unemployment. As you probably heard, a lot of times you couldn't get through on the unemployment line, or people would say, I've called 100 times today and I can't get through. We got many calls at 211 as a backup saying, what do? I can't get through. Is there any other way? Do you know anything about any job training? I need to find something else, another job. How can you help me? Very panicky calls. I mean, this is obviously COVID has been a struggle for everyone, but when you lose your job and you're kind of afraid of what tomorrow is going to bring, it's really nice to have this this place you can call 24 hours a day. And then again, for seniors and those with disabilities, there is information in the database on respite care, home care, transportation. So organizations like Batavia RSVP is in there, Age Guide is in there, Meals on Wheels is in there. It's just a great resource for seniors and their families. It seems like it's largely families that are the first call. And then again, for the youth and families, after school programs, tutoring, mentorship, counseling, recreation, you name it, it's there. And if it's not there, we need to find it and get it in the database. So currently, this is the map of coverage across the country. Illinois and Arkansas are in shades of gray. We're getting there in Illinois. But interestingly, in Illinois, 211 is set up by county, and every single county is basically funded in a different way. So there's no consistency. It's, whatever county you are, go out and see how you can make this work, and you're kind of on your own. So there is hope that down the road, like the state of Maryland, like the state of Texas, we're hoping that at some point it becomes a government-sponsored program. But again, we're in Illinois. We'll see how that goes. So for now, we have really great support with schools and with the county government. And this is across the country. 285,000 plus veterans were served last year. That's great. We have a lot of veterans information in the database. And then 12.8 million connections to help in 2018. So we're still waiting for 2019 numbers. 2020 will be really interesting. So again, our crisis center, Path Crisis, is in Bloomington. They are strategically placed between Illinois State and there's another university down there that's escaping me, but there's two universities down there. So they are strategically placed between them and can tap into, they really tap into the social service and psychology interns. And they get their staff from there, and they go through a very intense training program. It's a great, interns are a great source of help for them for manning the phones. And they're just a great backup for, like it says, the flu triage calls, or in our case, COVID, and a backup to the health department, the police department, the fire department, and the suicide hotline. This is probably a little hard to read on your screen, but it kind of gives you a breakdown of what the calls were by need for 2019. Sadly, housing assistance is the top one, and then utilities right behind it. So you can kind of see what people are calling about and what help is needed. Trying to see where anything senior specific. Yep, information for seniors is that kind of olive colored piece. And then here's a breakdown just by numbers for 2019. And I'm sure it'll be really interesting to stack these numbers up compared to 2020 when it comes to the effects of COVID. And then what can you do to help with 211? Gosh, I put it in red. Spread the word. This is our biggest need for 211. The Dunham Fund grant specifically allowed us to hire a contract employee to go out and do presentations, to be part of Zoom calls such as this. Back in the day when we had them, they would go to the resource fairs and have a tent at the summer events and things like that. That's been kind of squashed for right now. But we do have, thanks to them, we have the person on staff to be able to deliver materials, come out and speak to people. But it's a constant state of spreading the word, because this is a fantastic benefit and a great help to people. But if they don't know about it, then, you know, that's our biggest obstacle right now. So I'm going to stop the screen. Let's see if I can, there you are. So, so in listening to all of you talk, I mean, Glenda's been fantastic in including us at CRT meetings and connecting us to other people where we can send Lisa out to do presentations and that, but always open to new ideas on how to spread the word. Would love to be part of Patty's newsletter. And then I think I made a note here, Liz mentioned a senior radio program. Would love to be part of something like that. So any ideas that you have in helping us spread the word, we would appreciate it. But I want to go back a little bit for a minute and see what kind of questions you have about 211. It's been in existence since November 2018. So we're really entering our third year starts in August, actually. Any questions?
Melinda, is there a like a LinkedIn ready or a Facebook ready post that maybe we could share with our networks if
Yes.
such a thing existed?
Yes, we do have some Facebook posts. We have Twitter. Is that a post? What do you call that? Twitter. A
Tweets.
Twitter graphic. Thank you. We've got, as I said, business card, a little marketing pieces that have been delivered with Meals on Wheels. We deliver them at the low-income housing units where people don't have a full staff on hand to be able to go to for questions and that. We have flyers, banners that we use for the different fairs and things like that. So yes, all that is available, and through the grant that we have through the Community Foundation, it's all no cost. So if you do a mailing, we'd love to have, a graphic, just a little, I'll send some around so you can see what they kind of look like. They're pretty simple, and pretty to the point, but for seniors in particular, we seem to get a lot of, 211 tells me we get a lot of what they call comfort calls, where they'll tell us that, we get calls that they don't really want anything specific, but they have an excuse to call just to talk to somebody. So we keep trying to let the hospitals know how good this is for them too. So I go back to my parents. My mom was in the hospital and my dad was arranging for memory care, and he was talking with the social worker at the hospital. And I was down for a visit a year later, and he had his card, her business card out by the phone. And I said, "Oh, are you still in touch with this gal?" And he says, "Oh yeah, I call her all the time because she's just so nice and so helpful." And I'm thinking, and she is so ready to move on to her next client, Dad. But so, I mean, it would have been nice for him to know about a 211, and he could just call and kind of bend their ear a little bit, So, so it's I'd like to see it as part of the discharge planning process at every hospital. So.
Yeah, if you could share those graphics, that would be great.
Sure.
We can even put something out on our new Facebook page when we get it.
Well, that would be great. Yeah, that'd be great.
So are we able to?
Sorry.
Go ahead, Angela.
Has it been given to the Batavia Ministry Association? They were asking for resources. They meet once a month on Zoom, and they've been looking for this. This is exactly what they've been looking for, and I didn't know if they had been contacted with something like that.
And it's interesting because they have been contacted. I know someone from our school district has pitched 211 to them, but I don't know that we have specifically, and I would love to, because they have, they have a network like no other. So yeah, if you have a way to help us get on their schedule, we would love that. Yeah.
I do. So look, okay, I do.
Yeah. And I know at the homestead, they talked, I think Lisa talked to Nicole over there, and she delivered 200 211 refrigerator magnets. So that's a nice reminder for seniors, just to kind of pop it on the refrigerator and a reminder that service is there. So we have those if anybody needs them too.
Okay. Yeah, I'll get you connected with the Pastors Association.
That'd be great.
I know when I originally talked to you guys some time ago, if you were a for-profit company, you were not able to be listed. Is that still the case?
It pretty much is, unless you have a reduced fee schedule or something specific to cater to those with lower income. Otherwise, if we put every for-profit, psychologist and social worker and that in the directory, it would be really, I think it would be really cumbersome. So what they did was they took, to get this set up, we took the Kane County Guide. Were you familiar with that at all? So no, let's see.
No.
And that kind of makes the point. But Kane County paid for a guide, an online guide that you could just go into Kane County Guide and type in your zip code and what service you were looking for, and you were to do your research yourself. And when we pitched 211, it was interesting because there's a little bit of a competition about, well, you're gonna hurt the guide, but people didn't know about it, and that eliminates so many seniors because they're not online. And to go through and try to sort this out yourself, you don't even know what to ask. I wouldn't know where to even begin to look for a handicap ramp. So if you just Google that, you're going to get way too much information. So in the end, we convinced the team that ran the Kane County Guide that this would actually just be taking the guide to the next level. So we took their database and we dumped it into the 211 system, and then they took the PATH staff took 3 months to go through and audit all the information just to bring everything up to date and make sure we still had the correct contact people and our business hours and things like that. So that was kind of our starting point. So there was thousands of resources already in there. And then we've been just reaching out throughout the community and again, spreading the word that if you're not in the guide in the database, we need to get you in there. So we went to, we talked to the Northern Illinois Food Bank, who put us in touch with every single food pantry that they work with. And we did a mailing to them and said, let's check and make sure you're in the database. So, and it's easy to find out. If you have an agency, you can just call 211 and ask them. So it's really easy to find out if someone is not in the database, and then we want to get them in there.
So is there any way we could get KCSR in there? I just with what you were talking about, I think our members could help with a lot of different things.
Yes. So if you went on the PATH Crisis, Bloomington, Illinois, that's how I would Google it, website for 211, there is a provider form. So you could fill that out and send it in. And then PATH reviews it. If it meets their criteria, then yes, you're added to the database immediately.
Okay.
Thanks, Melinda. We do have you in our newsletter.
Oh, good.
And I guess you still are PATH. I didn't know if you still went with the PATH logo also.
So I'm Batavia United Way. So we spearheaded the project and kind of pulled all the pieces together, but we contract with PATH and they have the call center. So all the phone calls come into their call center. So they do all the training, and we pay them. It's pretty open book. We pay them $5,000 a month for our to serve Kane County for us. So all the calls go to PATH. So that's our administrator, so to speak.
And maybe you mentioned this before. Is LaSalle County in 211?
I don't know LaSalle County.
What happens, like, if a client, because we have multiple counties that seniors come to our center from.
Mm-hmm.
What happens if a person calls 211 from a county that's not registered with 211?
The phone number won't work if they dial it from their phone. So if you call 211, but there's an 800 number backup. So they could call the full 800 number and get in. But if the county doesn't have 211, there won't be a massive database of information for them. But for example, DuPage County does not have 211, but St. Charles is part DuPage and part Kane, from what I understand. So if you are working in Kane, but live in DuPage, if you're at your office, you can call and get information. And we all know that. I mean, I live in Batavia, but I'll go to CDH in Wheaton, right? So they're out of the 211 network, but we cross borders all the time. So so you can still live in DuPage and get some help. You'd have to call the 800 number, and it'd have to be something that is obviously convenient for you. But I can tell you DeKalb County has it. Rockford, that their county has 211. Lake County just went live last September, so they have it.
What about Kendall?
Kendall does not. So they would like to have it, but again, it's the funding. You know, where are we going to get the money to pay for it? So if you figure Kane County is about 500,000 residents, and we're paying $5,000 a month for service. I mean, I've talked to Kane County United Way, and they would love to have it. She just said, I can't rally the funding right now.
Mm-hmm.
So,
Thank
which is
you.
really, which is too bad, because it's, you know, people need it. So.
How does it work with, like, say, Elgin, where they have 311?
That is a good question. People just have to be educated on the difference of the numbers. And there's a small crossover area up there. And there was concerns at first when we were talking about 211 that it was going to be too confusing or too much crossover. But it seems to be working, and there's areas of Elgin that don't have 311 from what I understand. That kind of falls more under what used to be the Elgin United Way territory. They know that area certainly better than I do. But right now they have both numbers. They have 911, 311, and 211. So, and they're talking about putting together a graphic that kind of shows what the difference is in the numbers. Because in the city of Chicago, and actually in Batavia, 311 is more public works. So so you do kind of need a little cheat sheet to define what each of these numbers is for. I think that's the only area of crossover we have in the county, though.
Any other questions for Melinda?
No?
Okay, well, thank you very much for being with us.
Yeah, thank you for having me. You can always find us at Batavia United Way, and I'll circulate some of the marketing materials so you know what your options are. And if there's something that you need specific to your group, just let us know. Okay?
Perfect. Thank you very much.
All right,
Thanks,
thank
Melinda.
you. All right, you all have a good day.
And with that, I think we'll end our meeting. Our next meeting will also be by Zoom on July 9th. So see y'all then, and wait for the links to come out.